Hi, Dr. Saxena here, and we'll be talking something on what is this long hauler means. The people who got COVID or the people who got vaccines post the things after you pass up the infection and you get into a stage of chronic problem. And the most of these people who had successfully got treated in the hospitals, they have gone, their acute phase is over, they went into something called COVID long haulers. So, talking on one particular thing, there was a thing which was always bothering us. I had one of the patient who came. She had COVID, and after that 3 months later also she says she's not able to walk for 3 4 steps. She's having that cough, she's having that particular lot of confusion, and kind of it's her there's some kind of we call it as a fog, mental fog we call it as. So there, this were this presentations which were uh, so many people had these presentations, and we it is like um, uh, we when we started looking in more, I had seen lots and lot of people have got this problem. And I just wanted to tell you about this long haul COVID syndrome. And this was, we last year we couldn't pick up, and this is now people are having we used to think that he is having some kind of, he is malingering, or he or she is having some psychiatric problems and all that. um, this is one real things people started having. They had headaches, they had some kind of breathlessness, they had some allergies, they had some fear. Is trying to work on one of the patients who had like he doesn't sleep for just less than 1 hour or something like that. So these are all the things which we tried looking in that. I just wanted to make a quick statement here. Okay, this is particular thing, and there is a role of simple treatments. We try to work it out, something like high dose vitamin C. We try to give something like a ivermectin and some kind of steroid, or try to work on something which is something like a statin drug. These are all the things which are helping. And this is such a to whoever we have treated, the people having this post-COVID sequele, which is called long haul, this one. And the turnout time within 3 sessions, they started getting just a simple thing like a hyperbaric oxygen also helped 4 of my cases. And it just that fogginess, everything went off. So with the kind of work which is being done by this group called FLCC. And it is one thing what I picked up is it's a simple approach, giving ivermectin tablets. We try to work on that, and if the people are not responding to ivermectin within a week, we put on some kind of steroids, try to again work out with some kind of high dose vitamin C, hyperbaric oxygen, or something like a statin drug. So this thing process is really working very well. I have good number of testimonies. And what I felt was that this antiparasitic drug, which ivermectin was, is a decades old antiparasitic drug, it is really working wonderfully, both in the initial stages of viral phase of illness when antivirals are required, as well as the inflammatory stage also. And see, this is the big beauty, that when there is an inflammatory stage, the viral load drops off and anti-inflammatories become necessary. It has been shown to significantly um, um, inhibit SARS-CoV-2 replication in vitro, and it speeds up the viral clearance and dramatically reduces the risk of death. The kind of work which was being done by Dr. Tess Lawrie, is a director of evidence-based medicine consultancy, and in the UK. This is a panel. This is one of the forefront. These people, they organized a thing called BIRD. B stands for British Ivermectin Recommendation Development Panel, and it was a international conference on ivermectin. Also was held in late April 2021, and where 12 medical experts, they shared their knowledge during this conference. And this is one thing which take home from that Zoom was, I'm very sure you need to work on this ivermectin a lot, and trying to use judiciously high dose vitamin C, as well as some oxidative therapy or oxygen therapy. Can always, if you don't have hyperbaric and all that, you can always fall back to hydrogen peroxide nebulization as well. So this is one of the good things, and we are really we don't understand why the WHO refuses to recommend ivermectin. And this is one thing which there are a lot of papers have been propped up, and I certainly would like to my patients do get this thing called ivermectin, and we keep giving this particular thing in a big way, in the sense people who want prophylactically, the people who want to they are into some kind of problem also. For me, that is a real plus thing. Thank you.